Yeah, okay.
Now live from Times Square in New York, Carl Stefanovic, Lisa Wilkins.
And news anchor Julie Stoll is doing a documentary on Shane DeBone.
We're here with Shane DeBone, producer of a documentary on rhabdomyolysis, and also someone who has experienced rhabdomyolysis firsthand when he and 12 of his Iowa football teammates were diagnosed with the condition after a grueling August football practice. Shane, can you tell us about your experience with rhabdomyolysis?
Yes, thank you, Julie. It happened when I was a freshman football player on the University of Iowa football team. It was the first week of our strength and conditioning football program, and we had an irregularly intense workout session with the team. My body ached for 3 days after the workout, and the next time I went to the workout with the team, I could tell something was seriously wrong. I was dizzy, weak, in pain, and experiencing yellow to brown urine. At first, I thought I was extremely dehydrated. When they took us to the hospital, they told us that the components from our muscles breaking down was getting into our bloodstream and affecting our kidneys, as well as making us feel ill. Luckily, after we were treated and released from the hospital, we could all return back to playing football, but with a little more education this time.
So what exactly is rhabdomyolysis? What happened to your body during that workout?
Well, it's all in the word. Rhabdo means striated, myo refers to muscles, and lysis is the breakdown. So rhabdomyolysis is the breakdown of striated muscle tissue. I worked out too vigorously and my muscles weren't used to it. When this happens, your muscles go into panic mode and start to break down rapidly. This breakdown sends intracellular contents from the muscles into the circulatory system. This influx of muscular components in the bloodstream leads to electrolyte disturbances. Hypovolemia, which is a drop in blood plasma volume, metabolic acidosis, an increase in acid levels in your body, and renal failure produced by excess myoglobin in the blood. I just skipped the line. All right, go ahead.
So this is a condition that occurs from working out too much?
No, that is definitely one of the causes. But there are many things that can lead to acute cellular destruction of the muscle tissues. Any form of direct injury to the cell membranes in our body, such as crushing, tearing, burning, pounding, poisoning, or dissolving of our body tissues, can lead to an influx of toxins into the bloodstream. Other causes can be conditions such as muscular dystrophy, where muscles break down rapidly within the body, whether due to neuromuscular conditions such as ALS or caused by muscular inactivity. Other causes can be extreme muscular tremor, such as an alcoholism, or severe epilepsy may cause the muscles to break down and cause rhabdomyolysis. Other causes include severe electrolyte imbalances and disruptions to the sodium-potassium pump system within our body. Electrical shock is a common cause of rhabdomyolysis, as well as other heat-related risk factors, such as heat stroke, hypothermia, or burns. People are more at risk for rhabdomyolysis if they are using medications affecting the muscles, such as corticosteroids, or if they're using chemicals such as alcohol, CNS depressants, cocaine, amphetamine, ecstasy, LSD, PCP, or neuromuscular blocking agents. So as you can see, Julie, there are many factors that can trigger breakdown of the muscle tissue, and therefore cause rhabdomyolysis.
Does it happen to athletes often?
Well, yes, because these days there's such a push for athletic excellence in competing athletic or academic bodies. Often, competing athletes, young or old, are thrown into a vigorous exercise regimen when sports begin, and their bodies aren't prepared for the kind of abuse they demand of their muscles. Because of how it happened to me, and because it can happen to anyone, is the reason I wanted to make the documentary, to educate and make sure people don't wind up in the hospital like I did.
How exactly did they treat you for this condition when you were in the hospital?
Well, they told us they were following 3 procedures. The first was reducing any further muscle tissue damage by immobilizing us, loosening any tight-fitting clothing over our muscles, and monitoring us for swelling or compartment syndrome, which occurs when specific area sees intense swelling. Then they did everything they could to clear the toxins out of our systems, which included hydrating us, trying to keep our urine alkaline, which is greater than a pH of 6, and giving us IVs of mannitol, which acts as a diuretic and a renal vasodilator. Basically, they made sure no further damage was done to our muscles or our kidneys.
Interesting. Now tell me, did you know what rhabdomyolysis was before this event?
No, I did not, which is why I made the documentary. As you can see in the film, a lot of people have absolutely no idea that rhabdomyolysis even exists or how it could happen to them. Interestingly, rhabdomyolysis was first described in the victims of crush injuries during the 1940 bombing raids on England during World War II. Rhabdomyolysis has a diverse range of causes. People of any age, race, sex, or background are just as likely to get this condition. Overall, it has a slightly higher incidence in males because of two subgroups. One being trauma, because this can happen to any males who do physical labor, such as construction. The other is inherited enzyme deficiencies. One is incidence of the condition that the older generation should be aware of is the risk of crushing injuries during falls. A lot of older people wind up with rhabdomyolysis in the hospital from crushing fall on a shoulder or on a hip.
Interesting. Now, I think our viewers would be curious to know how many people get rhabdomyolysis on a yearly basis?
Well, this disorder affects 1 in every 10,000 people, and 26,000 cases are reported annually in the U.S. according to reports by the American Academy of Family Physicians. It is said to be widely underreported because sometimes it is treated as severe dehydration.
Okay. Now, the diagnosis seems very similar to dehydration. How can you differentiate between general dehydration and rhabdomyolysis?
That's a good question. Many of the symptoms are similar between dehydration and rhabdomyolysis, such as urine discoloration, general weakness, dizziness, altered mental status, and decreased urine output. But with rhabdomyolysis, there is muscle tenderness, swelling, and aching, as well as a lot of voluntary movement of the muscles. The most reliable indicator that someone has rhabdomyolysis is a test for creatine kinase, a component of muscle breakdown in the blood. Another test that may confirm rhabdo is a myoglobin test in the blood, but myoglobin passes out of the bloodstream so quickly that into the kidneys, so it is hard to detect. Also, in-depth urine analysis may show signs of rhabdomyolysis based on muscle tissue components and acidity levels in the urine.
Okay, that sounds pretty severe. How severe can rhabdomyolysis become, and what's the prognosis?
Well, that's a good question. It all depends on the severity of tissue destruction and how long it takes for a person to receive treatment after the cause. It can range from mild symptoms, such as I had, dizziness and urine discoloration, and generally feeling malaise or feeling strange, or it can range to like very severe or complete renal failure or death, depending on how much damage is done to the kidneys. Other factors that affect the outcome are comorbidities, general health, and the age of the person.
Interesting. So, Shane, what is one important message you would like to give to our viewers and listeners today?
Just to be educated about your body and understand the signs and symptoms of rhabdomyolysis and seek treatment as quickly as possible. I hope that between this interview and putting the documentary out there, it will help educate people about widely unknown condition yet deadly if people are uneducated and don't seek treatment right away.
All right, thank you very much for